You want to hear your best. If you don't care, like, go wherever. It doesn't matter, right? If you don't care about your hearing, we probably don't want to come to us because we'll end up caring way more than you
Yeah.
will. And you'll be like, these guys are
Yeah, they're like,
insufferable. I cannot stand Applied Hearing Solutions. I wish I would not have scheduled here. Hey guys, welcome back to the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And I am joined today by two very special guests. We have Ashley Olson, who you guys may recognize as my wife, but also the clinic director at Applied Hearing Solutions. And for her second time on the Dr. Cliff Show, we have Jena Wingett, who is our audiology extern. You're only a couple of months away from
almost there, almost
yeah,
there.
the Dr. Jena Wingett here
Yes.
pretty soon. So, but the topic that we're going to be talking about today is when you're someone who has hearing difficulty, what is the first step that you need to do in order to make sure that you're scheduling the right type of appointment with Applied Hearing Solutions in this case? But I will contextualize this that coming and scheduling or calling and scheduling an appointment at our clinic might be a little bit different than when you call and schedule with a different clinic. So you can still learn about the things that we're trying to do when we schedule inside of our clinic for a consultation appointment or maybe even a different type of appointment. But you can take that information and use it elsewhere as well to change maybe your expectations of what you should be getting. So with that being said, Ashley, I'm going to come to you first because you do a ton of training with our front office staff for these phone calls that come into our clinic for the reason of making sure that you identify the most appropriate type of appointment for a patient.
Yes.
So what are the types of things that you're looking for?
Yeah. So I guess first and foremost, excited to be on the podcast, my debut first time. And I would echo that anyone that is experiencing a hearing loss or just noticing that they're having difficulty hearing or noticing a loved one, the first thing to do is to either call our clinic or to call your local clinic wherever you're at to get your hearing evaluated. But a lot of folks, when they call in, they don't necessarily know what type of appointment they should be asking to get scheduled for. And that's okay, because ultimately it's the responsibility of our front office team to ask the right questions, to garner the information for us to identify what is the best appointment to be making. So oftentimes when we ask individuals, what kind of hearing difficulties have you been noticing? They might say things like, oh, well, my spouse is getting frustrated because I'm asking them to repeat themselves quite a bit, and then we kind of talk about, what type of environments that would be in. A lot of individuals report difficulty understanding speech. And so they'll say things like, it's not that I can't hear them, I just can't understand what they're saying. They often say the same thing when they're watching like TV or movies. They'll tell us, it's like, well, I turn the volume up and it's not that I can't hear the movie, I just can't understand what they're saying. So a lot of times they have to use closed captions to be able to effectively watch a movie or TV. And the other aspect of that is, typically they're watching the TV and the movie by themselves because their companion is unable to comfortably sit and watch with the TV at that level. So there's just a lot of information that we're garnering from those phone calls that help us to identify, this is definitely going to be a recommendation for an Applied 360 Discover.
Yeah, so an Applied 360 Discover consultation, just so everyone's clear here, we had to kind of give it this name because it's not traditional. So a lot of clinics that you'll call and you want to schedule your hearing test, oftentimes your free hearing test.
Yeah.
And they schedule you for 30 to 45 minutes. They test your hearing really quick. They make a quick recommendation for whatever product that they sell inside of that clinic, and then you're good to go. So for a lot of clinics, it's super easy. Like, oh, like you have hearing difficulty, I'm just going to schedule you for this one type of appointment that we have. For us, we had to break things up into different types of appointments, and the Applied 360 Discover consultation is for individuals who might be new to hearing loss, like they know that they have hearing difficulty, but they're not sure where to start.
Yep.
We schedule 2 hours of time for these Discover consultations, and that it truly is a discovery period for us as a provider with them. But you need to make sure that because it's a 2-hour commitment on our part and on the patient's part, so you need to make sure that you properly identify that that's the type of appointment that they need.
Yeah, I mean, some individuals that call us, they might have hearing loss, but it's not because they have a long-standing history of like damaged hair cells and they're unable to get sound from their ear to their brain. Some individuals are unable to get sound to their brain because they have earwax impaction. And so that's a matter of asking, you know, specific questions about that based on what the patient is reporting. And so oftentimes when we ask individuals like, well, tell me what's going on with your hearing, they might say things like, well, I've just noticed that my hearing is muffled. It's like, oh, well, how long have you been experiencing that? Well, you know, like since last week, or sometimes folks, surprisingly, will somehow manage with earwax impactions for, you know, sometimes up to 30 days. I have seen it a little bit longer than that, but most of the time it's fairly acute. Or they'll say things like, my ear is itchy, like I can feel like something's in there. Sometimes they'll say things like, I actually squirted water in my ear and I think I moved it and now I really can't hear, right? So there are certain types of questions and conversations that we have with individuals that lead us to scheduling with a new patient earwax removal, right? Versus an Applied360 Discover.
Or someone might need hearing protection for shooting on the range, or you know, ear impressions for in-ear monitors for music plugs, things like that, that you would need to properly identify during that initial phone call. So it's important to understand that even if you don't know what type of appointment you should be scheduling, that is our responsibility to make sure that we're asking the right types of questions to get you put into the right appointment type.
Yeah.
Right.
And just to be clear, we can schedule a hearing test. I mean, we have a lot of younger individuals who have family members that have hearing loss, and they're concerned that they want to understand how their current auditory system is functioning, how their hearing organ is, the health of that. And so a lot of the younger individuals might be calling to schedule a baseline hearing test just so that they are informed on the status of their auditory system.
And don't be surprised, though, if you're asking these questions and it's hearing difficulty related, that you believe it needs a full consultation time, that you ask for someone who is also a companion of theirs to come in with them to their appointment.
Yeah, and that is a very common question that we'll ask individuals that have called to schedule. You know, we simply ask them, like, is there someone that you spend a lot of your time with each day? Or, you know, when it comes to having conversations, is there a person in your life that you're having more conversations with than others? And how has that been going, right? And trying to identify who their companion is. And for some people, it's a spouse. For some, it's like their best friend or their neighbor. And having that conversation and explaining the importance of making sure that when we schedule, we're accommodating both individuals' schedule, because we know how important it is to have the other perspective of a companion's perspective on their hearing loss.
And oftentimes, even if the companion can't come in, we as providers will often be like, I need more information. And so we'll call the companion, whether it's a child, spouse, like you said.
Right. Now, that's a good point. Again, that is also something that we talk about in our phone calls. So we really try to avoid individuals feeling unsure or unknown of what to expect when they come in. So by the end of the phone call, they know exactly what to expect and why we're asking certain things of them, right? And I think that explaining what we need and why we need that kind of eases a lot of any like questions or uncertainties about what to expect.
And one of the other things you need is pre-appointment paperwork.
Yes, yes. I mean, as per usual, when you schedule anywhere, there's some type of form to fill out. Luckily, I really want to keep it to a minimum. We've all had the experience of going to like your dentist or your primary care, and like seems like every time you're going, you're like filling out 10 forms, and you're like, oh my gosh, it takes forever. So, you know, ours is very minimal. We have a couple of HIPAA compliant forms that we are required for our patients to fill out, especially if you'd ever want someone to call on your behalf. Legally, you have to put them on that form for us to talk about anything, even if it's your appointment time, right? So just make sure you fill out your HIPAA forms for sure.
And they can submit that digitally. So it's super simple to do. It doesn't take a lot of time.
No, you can fill it out on your phone, a tablet, your computer. All you have to do is enter into the text box and hit submit. So it's very simple.
There is another thing that we request for our patients, and that is the reservation deposit for that appointment.
Yeah.
Now, this deposit that you collect on that initial phone call goes towards the cost of that consultation.
It does. So, I would say maybe 5 or 6 years ago, perhaps it all started during COVID. We decided to start collecting reservation deposits because we had noticed, for whatever reason, an influx of like last minute cancellations and like no shows. And we do reserve that 2 hours with our audiologist and with the patient. So essentially, we just want to make sure that when we're scheduling individuals for a 360, Applied 360 Discover, we're committed to giving you our all during that time. And we also want your commitment to respect not just our time, but more importantly, to respect the other patient's time, because there are patients that come from out of state. We have patients that sometimes wait 2 and 3 weeks to get in. And so we just really want a mutual respect of everyone's time and ensure that those patients that schedule are willing to come in and.
For sure. And I would say that, like, in what medical setting do you ever go to that you have 2 hours of time with your doctor?
I know.
Like, I can't remember the last time I saw a doctor for anything more than a few minutes.
Exactly.
They just like, well, tell me what the problem is. Okay, here's what you're going to do. And that's literally it.
Yeah.
And so the way that we structure the clinic is that we don't want to have, assistants doing everything. We want there to be a cohesion with the patient and the provider, the doctor of audiology, to make sure that we have enough time to uncover everything that we need to uncover, which Jena will be talking about that here in a second. Thank you for waiting so patiently over there. But the other thing I think that we should touch base on before we move into what actually happens during this obscene 2-hour long period of time that you want me to come in for, which is for good reason, and I'll hold you in suspense for that. But we have multiple audiologists in the office. And oftentimes people will call and be like, hey, I saw this guy on YouTube and I want to see him, and I only want to see him because I think he's the only person who can solve this. Now, don't get me wrong, I am flattered by that, but that is just not the truth.
Sure. Yeah, I would say that, of course, we get a lot of folks that just want to see you, and that's okay. But the challenge with that is your schedule is limited and certainly not flexible. And I will say, like, we have 2 other fantastic providers in our office.
Soon to be 3 with Dr. Wingett.
Soon to be 3 that have spent an entire year essentially under your apprenticeship learning from your expertise. And they are just as committed and passionate about comprehensive best practices as you are. And, personally, if I had any of my friends or family that called and they wanted to get as soon as possible, like if you want to get in within a week or 2, you're not going to get in with you. Because you're just you're not in the office as much and you don't have that availability. And I have no reservations scheduling any of our patients with with Dr. Beck and Dr. Balderas. Now, what I will say is that, like, I am very, very passionate about training. And I think that is something as a professional that needs to be done, because I think technology is always changing and evolving. And our practice in particular, we get a lot of complex cases, as you've seen throughout the last year. We don't just get the easy peasy hearing losses, right? We're getting people with complex surgical histories, reverse slopes, cookie bites. We're getting like really tough, challenging cases. Hyperacusis, don't even get me started. Like, there's like a lot that goes on with that. And so we train on these complexities all of the time. And so if there's any concern that, the place that you're going maybe isn't, giving you the outcomes that you think, like, give us a call, because we're used to complex. We're not used to easy. I mean, we can do easy, but we just don't get a lot of easy anymore.
Yeah, a lot of my training when I was coming up, when I was in Jena's position as a 4th-year extern, I worked at a neuro-otology clinic, and I didn't see a normal hearing loss the entire year. It was all crazy off-the-wall hearing losses that you had to figure out a way to think outside the box to do the treatment.
Yep.
And I've been trying to pass on that knowledge to the rest of the providers in the office. And coincidentally, we have a training later today,
Yep.
training on complex cases of hearing losses and how you go about treating them effectively. So when someone calls and they want to see Dr. Cliff, it's like, well, you have other fantastic, just as qualified options to schedule with from a doctor of audiology standpoint.
I feel very fortunate that we have such wonderful providers at our office that are committed to this continuous idea of training and challenging, their knowledge. But it's just the only way to get better is to keep training, right? And to improve upon our skills and expand our knowledge on how we can best serve our patients.
And they're nice people too. You actually might
very
like them
nice.
more than you like me. I don't know.
That's so funny. Well, I have a story about that. A patient who was like, "Oh yeah, can I just stay with you?" And he was talking about Dr. Beck. He asked Dr. Beck if he could stay with her instead of going to
instead of going to me. Okay. Well, we didn't have to say that on the show, but I appreciate that regardless.
Some personalities just like certain personalities. It's okay.
I will not take any offense to that. So that's awesome. So that's how we identify how to schedule the most appropriate type of appointment. In a lot of cases, it is an Applied360 Discover consultation. And so now people are wondering, well, like, that's great. I'm on the books for 2 hours of your time. I've paid my reservation deposit. I'm coming in on Tuesday at 10 o'clock. Jena, what types of things are we going to be covering throughout a 2-hour time period that is over double the time that most places will spend?
Yeah, so we go over a lot, and sometimes 2 hours doesn't even feel like enough. So right off the bat, when they come in, we need to get a good understanding of what even brings them in, what sort of difficulties they're having. We also ask a lot of questions related to just health as well, because it's important for us to see if there is any sort of red flags that would lead us to possibly refer them to another ENT or something like that. So there's a lot that goes into us getting the whole picture of the patient as well, not just the ears itself, but what's going on with the patient entirely.
And so there's some questions that they're like kind of thrown off by. It's like we're asking questions about their vision, their finger dexterity. We're asking about diabetes history. We're asking about cognition. And if you guys have been paying attention, there's a lot of a focus around how is hearing loss impacting your overall cognition and leading you potentially to a higher risk of dementia. So we have to spend a decent amount of time going through all of these questions that we ask everybody. And at the end of it, we have a much better understanding of what their health history is to refer out, essentially, if we have to. But then we go into the next phase, which is we've taken the information initially that they told us, plus we have information from the front office when they put notes in upon scheduling. But we go through all of these different common areas of hearing difficulty and arguably too much time. But we do this for a very particular reason.
Yeah. It's really important for us to be able to understand where their difficulties lie and also to piece out a little bit more. Because a lot of the time with all of the questions that we ask, patients don't fully realize that they were having difficulty in that area until we bring up that point. One of the things that was always one of the questions that we ask that they don't even realize is television. Usually, even with the spouse, if they're in there too, they're like, when we ask, how is the TV? They're like, oh, it's loud. And even the spouse is like, yeah, it's too loud. But one of the questions that always brings up a thought of, oh, I've never even thought about that is with the TV, even if they do end up cranking it up, does it actually get crystal clear or does it just get louder? And there's all those questions that we ask for a reason so we can get a good understanding and also just to have the patient focus more and like piece out different things that they might not have thought of before.
Exactly. And we actually dig a couple layers deep on that. So we're actually, it might just seem surface level, like, are you having difficulty on TV? Yes or no, right? And it's more than that. Like, we're digging underneath that further to identify, okay, that's interesting that when you increase the volume, it does not get clearer. It gets louder, but still stays muddy. And that tells us something about your auditory system that we use when we come back and we actually are looking for something on an audiogram. So that part is very important. It's also super important, we touched base on this already, to have someone who's a communication partner in there with them, whether it's spouse, child, partner, a friend, a close friend, to come in, because communication is always a two-way street. Well, I
Exactly.
don't want to say always. If you're streaming the TV, that's a one-way street, but it's almost always a two-way street when you're communicating with other individuals. And the person with the hearing loss often does not understand the full magnitude, which means they cannot communicate that to us. So we have to get more information from the other individual. And if a patient does not come in with a, companion to that appointment, we end up getting on the phone with them. We had a very specific circumstance a couple weeks ago where a patient came in, they're like, yeah, I'm not able to hear my husband. My husband has a certain type of voice that I just can't hear and can't understand. I'm like, well, shoot, it's too bad he didn't come in with your appointment. She's like, yeah, he has another thing going on. I'm like, well, we need to give him a call, because how am I going to make a recommendation for the main area of difficulty that you have if I don't understand what I'm actually trying to solve for? So what do? We get him on the phone. We spend a few minutes talking to him. I'm like, okay, now I understand the tonality of his voice, how much he projects, and now I can make a very specific recommendation to solve for that particular problem. And we could not have found that out unless we had that individual either present in person or present on the phone. Okay.
Exactly.
I also think that, like, when it comes to the companion, like, I think we've probably all had the experience where we're just busy and we're into the day-to-day of life, and maybe we aren't always aware of every situation and every possibility or possible way that our hearing loss is impacting us, and that other person's eyes and perspective, I think also just helps create a full picture of, like, really what's going on.
Yeah, it can be really good if they're able to make the appointment, because those 2 hours are not only necessarily for the patient, but also for the companion as well. They provide that good perspective of the outside view of how the hearing is impacting the patient. But then even the education that we provide can sometimes, even with the companion, they don't really realize the full impact of what the hearing loss is having on the patient until we do go through that education. They're like, oh gosh, okay, yeah, I understand why this is frustrating for you. I understand why you're having such difficulty.
And then they're more willing to change their communication style with the patient even after treatment, which is super important. In fact, we actually encourage companions to come back with the patient during their fitting so they can see the complexity of what we're trying to do from a treatment standpoint, and that really opens their eyes as well. So super helpful to have the companion while we're going through this line of questioning with the patient. And then what's the most important thing that we're looking for, though, during this initial 45 minutes of this appointment?
The very last thing that we will ask before we move on is, what is the number one most important thing that you need to be able to hear? And other priorities as well, because it's really important for us to understand where their priorities are, what they need to be able to hear, because that will we'll have to tailor our recommendations based on what they actually need and what's their priority.
It is one thing that's a pet peeve of mine is when a professional goes in with a bias of, I think that you need this. And really, that's not what the patient's looking for. They might have completely different priorities than I think that they should have, because I'm a different person than them. And so if we don't understand what their, like, we might know where all their difficulties are at. That doesn't mean we know what the priorities are for that individual. So getting the top, usually 2 to 3 highest priorities can sometimes completely change what our recommendation would be. And we need to know what those are, what they're doing right now to try to overcome those situations. So then once we get done with the comprehensive evaluation, we can make a stronger recommendation to a treatment option that is actually more appropriate for them than we would have otherwise.
Exactly.
And so once we get done with that 45 minutes, and your guys are like, golly, we're 45 minutes in, you haven't even tested my hearing yet. Normally, I've had the sales pitch from the other clinic by 45 minutes, and I've said I need to think about it. But at 45 minutes, we're actually going in and we're starting the hearing evaluation that, of course, we spend more time on because we're looking for more things. So what is it that we're doing inside of this longer period of time that we're testing their hearing?
Yeah, so there's the basics that we, of course, still do, the pressing the buttons for the beep so we can hear the very quietest, understand the very quietest that they can hear, the speech in quiet, because that helps us understand if we do treat things perfectly, how well will they be able to comprehend in quiet. But one of the most important things that we do that some other places do not do is the speech and noise. Most of the time, day-to-day life, it's a complex situation. You're in some form of noise one way or another throughout the day. So it's really important for us to understand how much assistance the patient needs in noise. when it comes to us making any sort of recommendation.
I mean, just imagine what it would be like if the main thing is your concern is like, I can't hear in a restaurant, and then you go into a sound booth, you listen for beeps, you repeat back some words in quiet, and then they make a recommendation for you on treatment. It's like, but you have no idea how I function in a noisy environment. So that's why you have to do, that's why it's a part of best practices to do a speech and noise test. And we'll even administer a speech and noise test in multiple different ways to simulate different types of treatment that we would do on you. And whichever one you score the best on, that typically will lead us into a different recommendation than what we may have made otherwise. So taking the extra time to do that additional testing is critical if we want to have a better recommendation when it comes down to that time where we're actually recommending a certain type of hearing aid for an individual. So after we, put them through all this testing in the sound booth and we come back in, we actually take the time to explain the results. Now, the opinion in the industry is mixed on whether or not we should actually tell the patient what their hearing loss is. Can you believe that?
Unfortunately, yes.
So they're like, well, people don't make purchasing decisions on hearing aids based on what their audiogram shows. They make it based off of emotion or things like that. And I'm like, listen, I get it. I get that human beings are emotional creatures, but it is person-centered care to make sure that a patient understands what their hearing loss is in a very easy to understand way, I might add. We're not trying to give you an audiology degree in 15 minutes explaining your audiogram, but there's a way to explain an audiogram where it comes across as, oh, I actually understand my hearing loss now, and I understand why you're making a certain recommendation for a certain type of hearing aid to solve for my problem.
We actually at the checkout, when folks are leaving from their consultation, often we'll hear individuals say like, that's the most informative consultation I've ever had. And I actually understand now the kind of hearing loss I have. I understand why I can't hear in this situation. And so I think there's a lot of power in explaining things to a patient in the way that they understand, because then they feel like they can make a well-informed decision on their hearing health care. And I just wanted to make a statement, like the difference, there's a lot of differences with our practice than pretty much a lot of other practices, is that, we don't sell hearing aids. We treat hearing loss in our practice. And I think a lot of these other clinics that they might experience is more of a retail oriented experience and not so much of a medical model. But we don't, our perception is that we're not selling hearing aids. We're treating hearing loss here. We're giving people's lives back to them, right? And it's a big deal.
Well, it's the reason why 90% of the patients who come into the clinic say, I need to treat my hearing loss, where when you go to a typical hearing aid sales clinic, it's less than 50%.
Yeah.
Because you go in, you're just getting a sales pitch. You have no understanding of what's going on with your hearing.
Yeah.
You don't even believe that what they're recommending to you is the best option because they didn't educate you along the way.
And then they're not fitting and programming them using comprehensive best practices. So it's just, it's really a completely different approach on how we treat hearing healthcare at our practice. So.
And I just knew that when we started this clinic, that this is the approach that I wanted to take us in. It's like people struggle to find a place that's going to treat their hearing loss at a really high level. You can get hearing aids literally anywhere. You can drive. Someone was bragging like, hey, I opened up a clinic right down the street from Dr. Cliff. I'm like, that's great. Like, go sell your hearing aids down the clinic, right? You can go anywhere to get hearing aids, and you can probably spend even less money than what you spend when you come to us. But you're exactly right. We do not sell hearing aids. We treat hearing loss, and we do it at the highest level we possibly can because we follow comprehensive audiologic best practices. We never cut corners on treatment. I'm getting on my soapbox right now.
I know.
So okay, we get done explaining to them their hearing loss.
Yeah.
And so they're like, okay, I actually understand what's going on with my hearing now. Then we have to go into identifying the actual appropriate hearing aid for them. So what's that process like?
Exactly. We lay out all the different styles of hearing aids that are available. Then we, of course, take away the ones that would not even be good options given their hearing loss. But then from there, we go over the reasons to why you might want to go one way or another, the pros and cons that go with those hearing aids as well. And usually there are a couple options on the table, and then we get to ask the patient, with your perspective currently, all the things that you know now, are you leaning one way or the other? Do you have one knee-jerk reaction of, yes, I want this one, yes, I want this one. And then from there, we always also recommend what we think is the best option for the patient.
That's right.
Make the
And
decision.
so at the end of the day, I mean, we had a patient here recently who's been unsuccessful with receiver and canal hearing aids for a number of years at this point. The first thing she said when she came in is she's like, I want a hearing aid that goes inside of my ear this time, right? If I have to sacrifice some performance, I'm okay with that. I need that hearing aid in my ear. All the other reasons that she had for not wanting it, it's totally fine. But that changes our recommendation potentially. And if we're just trying to force her into a hearing aid that we think is best, or, you know, like some places will do, it's like, well, I only sell this one type of hearing aid, so it's either this or nothing. Like, that's not the approach that I believe we should be taking as a profession, as their hearing care professional. And so we take everything that they say and we incorporate that into our recommendation. Now, if they are like, Cliff, I just don't know. I don't know, Jenna, what should I do? We can make that recommendation of like, this is going to be the best option for you based off of all the information that we've obtained for you over the course of this last hour and 45 minutes. And then once we get the thumbs up, I'm like, yes, I think that is the direction I'm willing to go as the patient. Then we go into the explanation of what it's actually going to entail. Because I think a lot of people believe that, oh, great, you recommended the hearing aid, just put it in my ear, auto program it, and we're good to go. And that is just not how it works, at least not inside of our clinic.
Exactly.
So what else do we have to explain to them before we take them up front to get them scheduled for their fitting process?
Yeah, so we explain the structure of how we do things at the clinic. I always say that I don't care if you have $1 billion hearing aid. If it's not set up properly, you won't get the benefit out of it.
Where do I get $1 billion hearing aid at?
You could make one. I don't know. There probably is one that would exist. Aesthetically, make it out of gold. Who knows?
Yeah, there you go. Good point.
But the structure of how we do things in the clinic is completely different. We make sure that we have every patient go through a 45-day best practice fitting sequence where we fit them day one using real ear measurement, because it's really important for us to understand and actually fit the hearing aid to their prescription. But then even from there, we still have follow-ups where we fine-tune those devices from what they tell us, the data that we get from the hearing aid. So by that end of the 45 days, we know exactly how much benefit they'll get from a hearing aid, and it won't even get any better than that because we measure and verify everything along the way.
That's right. So super critical to make sure that they understand the commitment that they're going to be making, and the commitment, again, that we are going to be making, because we spend more than double the amount of time during the fitting process than what your standard clinic will do when they put the hearing aids in your ear and ask you how that sounds, right? There's a lot more that goes into it that I don't think a lot of people realize. Until they've experienced it, they're like, holy cow, I never knew that there was so much detail that went into this fitting process. And we actually had a patient, we're 3 weeks into her fitting. She asked me the other day, she's like, why do you guys care so much? I've never had anyone like spend this much time like digging for, can I get another 1 to 2 percentage points of benefit out of my hearing aid? And I'm like, I just think that people deserve it. Like, you're spending good money, you know, regardless of where you go, you're spending good money on hearing treatment. And I think that you are entitled to hearing your absolute best with whatever hearing aids that you're wearing. You actually, your grandfather struggled with hearing loss for a number of years, you share this story all the time.
Yeah. It's funny, like when I think back, when I was a younger kid, you know, like in elementary school, perhaps maybe I didn't notice a hearing loss, but really from the time that I was probably a teenager until, you know, my early 20s, when he passed away, I didn't know him any different than to have difficulty hearing. And oftentimes he wouldn't even wear his hearing aids because those made it worse, right? And he had multiple sets of hearing aids. And so I just like, for me, it's a personal thing that our practice is committed to continuing education, always like elevating the bar on our knowledge and our expertise. We're always up to speed on the latest and greatest technology, not just with hearing aids, but the equipment that we use in our practice. I am a huge advocate for training. We spend hours upon hours training not only our front office team, but our audiology assistant and our audiologist to ensure that anyone who walks through our doors, we are capable of treating their hearing loss, no matter how complex that it is. And the beauty of it is that we take the time that the patient needs for us to get it right, you know, because I'm committed to never having a patient experience the life that my grandfather did, being unable to hear the birds and communicate with his loved ones. I'm just very passionate about that.
Yeah, I think we're all passionate about that. We all know people, right? Like,
Yes.
we all know people who've struggled with their hearing. In fact, I think that's the only reason Jenna,
Exactly.
right?
That's what I was going to say, because many times it's like, oh, just an extern, but I've actually known you for 8+ years now, because my dad, same sort of story. I saw him struggling with the hearing aids that he had before until he ended up finding you. And with the experience that he had at Applied Hearing Solutions, quality of life is so much better. So it makes all that difference, which is how I even got into it.
That's
I
right.
saw the struggles that he went through, and I want to be able to provide the same sort of relief to patients as well, to actually be able to hear their loved ones again.
And it can be done. And all it takes is being extremely committed and being extremely well educated as a provider. And if you guys can find one of those wherever it is that you're living and you're watching this video content from, the key to your success is the professional that you see. If they are full on committed, if they're willing to spend the time, if they're following comprehensive best practices, your outcome will be better with that individual. So stop looking for the best hearing aid. Stop looking for that billion-dollar gold-plated hearing aid, and start looking for the best provider. And I promise you, your outcome will be better.
Yep.
Right? But that is not all that we do. We have to also explain what their first year in our clinic is going to be like, because we require every patient to be in a 1-year service plan for that first year of their care under us. So what do we do over the course of that year?
Exactly. After the 45 days, there's that 1-year service plan after that, because we don't just kick you to the curb even after that 45 days. So during that 1-year service plan, there's still those touch points that we have with the patient, but it's really important for us to explain to the patient what goes into comprehensive best practices. And there's a lot that we also need to learn about how much ongoing care that they'll need, because there's a lot of education that goes on during that 1 year. Most of the time after that, we've taught them so much, they can be so much more self-sufficient with the devices, that we just see patients for the things that they need as they go after that 1 year.
That's right. And so we typically, after that initial time period, it's like, listen, like, you know what you're doing now with your hearing treatment. You know how to identify if there's an issue, when you need to call us, when you can solve it for yourself. And so it reduces the requirement of you constantly having to come back into our clinic. And then we make individualized recommendations after that, like, Mr. Jones, you quite clearly can go 6 months in between your next visit. You know, Mrs. Jones, you're actually a little bit better than your husband. You can go a full year in between your appointments because you do a much better job of taking care of your hearing aids than he does, right? But we do not want to go longer than a year continuously seeing our patients. So even if you're not in a service plan with us, we still see you. We still recommend that you come in. You just pay for each thing that you need as you go. But perfect case in point here, literally yesterday had a patient come in. He's like, I've been doing great with my hearing aids that you reprogrammed for me. He came from the VA, had hearing aids not programmed very well. We reprogrammed them, got him back in the game. He was doing great. Came back in with his wife yesterday, and they're like, yeah, he's been doing pretty good. Yeah, I feel like I'm hearing well. It's like, great, let's get you in for your testing. We'll run diagnostics on your hearing aids. Find out that he has more hearing loss. And then I'm like, okay, explain that to him, help them understand what's going on. I'm like, I recommend that we reprogram your devices again. We go in, we do reader verification again, and we make some manipulations on his programming, and then I do a comparison of his new programming with his old programming by switching back and forth between the two programs, and he's like, oh my gosh, this sounds so much crisper and cleaner. I'm like, okay, well, do you want me to leave your old program in there just so you can make sure? And he's like, no, like, why would I want that? Like, it doesn't sound good anymore.
Yeah.
He came in saying that everything was great. I'm doing great. And he wasn't doing his best. And so that's why we require that people continuously come in for these ongoing appointments.
Yeah.
Okay.
You know, we've had conversations with folks too, especially individuals that might call us that have hearing aids already, and they'll voice their concerns. You know, like, I got these hearing aids and they just fit me with them, and then I came back 2 weeks later and like that was the end of it, right? And so sometimes what we have to do at the front office is like provide some reassurance and some confidence that we are different. We have a lot of support staff to help you with a lot of these things. And also, I think it's important that our doctors educate our patients so that they are also, I guess, informed on how to manage the basics of hearing aids, so that if they're on vacation and something goes awry, they have the knowledge and wherewithal to do some troubleshooting. Because if they don't know anything about their devices, it's very much anxiety provoking. It stresses them out. And so we don't get a lot of phone calls of people frantic, because we've provided them some easy at-home tools and resources that they can do to manage some basic issues they might have at home, such as like just changing your wax strap, right? Teaching your patients how to connect to Bluetooth. That is huge. I mean, because sometimes, you travel, you go to airports and things, go awry, whatever, and they can just easily check that. There's certain things they can check, and they just feel more confident about their devices.
We have a lot of patients who travel to see us from other states, and we actually teach them more stuff, and we actually send them home sometimes with different tools and components, and teach them how to do some at-home repairs so they're not going through the inconvenience of having to ship us devices, us shipping them loaners, things of that nature. So we really try to be all-encompassing when it comes to education and support for every patient who comes into our clinic. But that's a perfect segue into this Applied360 review process, because there are individuals out there who already have hearing aids and they're like, well, do I schedule an Applied360 Discover? I've had hearing aids. I'm looking for a second opinion. Like, could these be made better? Do I need new hearing aids? So that's actually a different line of questioning that you'll end up heading down during that initial phone call from them.
Sure. Yeah. I mean, some folks will call and they'll say, I'm calling, I've got these hearing aids, I've had them for a year. I just don't feel like I'm hearing as well as I should with these. And a lot of times they've probably done some research, they found our videos, and especially like the review videos. But, and usually when folks are saying that they have, hearing aids that are a year or 2 year, like that's not an old hearing aid, right? And so, in my mind, I'm kind of thinking like, oh, this might be a Applied360 review where, we can discuss with the patient on the phone that like, oh yeah, we have a perfect appointment for this, where you come in and you meet with the audiologist and we verify your hearing loss prescription, and then we do various evaluations on your actual hearing aids and then identify what we need to do to optimize the performance of those devices. And for some people, it's various factors. Different dome, different receiver, new ear molds.
The device is malfunctioning.
They're malfunctioning. I mean, all kinds of things. So that we uncover during that appointment.
Jena, what's the difference between an Applied360 Discover appointment and an Applied360 review consultation with a patient when they're coming in to see us?
Yeah, so there's that extra component of with their hearing aid themselves, we could take it to the back and make sure that we're doing maintenance check on them and running diagnostics on the hearing aids to see if it's actually meeting the manufacturer's specifications. If they are, then we're able to even do more of real ear measurement of the hearing aid as it's currently set up in the patient's ear, because that can give us a whole nother perspective of what we're dealing with and what would be the best option for the patient.
And sometimes we're able to reprogram their existing devices. So we identify that it's functioning the right way. We put it through the testing. We identify like, listen, you're not meeting your prescription with these hearing aids. Good news is, though, we can make some adjustments. Maybe we have to change some components on it, custom ear molds, a different type of dome, but start that reprogramming process sometimes almost immediately at that initial review appointment. And if we're not, then of course we get them on and have them come back and start their Applied360 refit process with them, which is a best practice refitting process we take them through. But sometimes you have patients who have 1-year-old devices, and those devices we identify are just not appropriate for them. And so we actually have to make a recommendation to change to different hearing aids if they want to accomplish the things that we identified from them at the beginning part of that consultation appointment. But whether you feel like you need new hearing aids or whether you feel like you can try to get by with your existing hearing aids, again, that's our responsibility to make sure that you are educated with the information, get you scheduled for the proper type of appointment, in this particular case, an Applied360 review consultation. And then it's our job to make sure that we're identifying everything we need to identify and convey that information so we can make a well-informed decision on both parts, on our part and on the patient's part.
I think the part that you mentioned with the education for the patient is really crucial, because our job, even if the device they came in with isn't the best one for them, our job isn't just to be like, okay, you need new ones. We provide the options of, even if you don't want to do anything at all, or we can reprogram these. We try to get ear molds for these and optimize at least the device that you do have to the best of our ability, or of course our best recommendation of new technology if that is appropriate for them. But we still lay out all the options and explain why you would want to go one way or another. That way the patient is then able to be educated, informed, and make the proper decision.
Yeah, it's like, it's not like we're presenting, well, you can do this, 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 and this. Which one do you want to do? It's
Right.
like they're educated to be able to make the decision, which is super important. I hate when people ask me like, well, we could do this or we could do that. Which one do you want to do? I'm like, oh, which one's best for me? I don't even know the differences
Right.
between the two,
Right.
right? And sometimes, for whatever limitations or reasons that the patient has, we do stick with hearing aids that they currently have that are not the best for them. But if we can make them perform 40, 50, 60% better than what they currently are, that is a way better decision than not doing anything at all.
Right.
And if you cannot upgrade to new technology for whatever reason, then we don't upgrade at that time. And then the next time that we come down to the point where they've been using those hearing aids that are maybe not ideal for them for a couple more years, then we make the recommendation, like, let's get you into something that is actually more appropriate for your level of hearing loss. And then we continue on with that.
I think that my mind is just like, I'm thinking about so many different patient scenarios that in conversations I've had on the phone. Ultimately, no patient wants to be in the situation where they come to us with hearing aids that they've had for a year or two and they're not working well for them. And you certainly don't want to come to us and find out that the hearing aid that you have actually is inappropriate for your hearing loss. So to avoid all of that, I mean, you want to go to a provider who's following comprehensive best practices, because best practices aren't just in the fitting and the programming of hearing aids. It is also used in the selection of the hearing aid. And what I'm finding is that a lot of individuals that, are part of insurance companies, whether it's, regular commercial insurance or Medicare Advantage insurance, you're going to providers that might take your insurance, might be in network, but they're only dispensing you the hearing aid that is covered under your benefit. And then 2 or 3 years go by and you're upset and you research and you find our videos and then we have to fix it, right? But ultimately, we're fixing something that is not truly the best for you. So to just avoid that situation and that outcome, just give us a call and we will set you up for success the first time.
Well, we actually have a lot of people call, to your point, that are like, I'm actually calling you guys because every other clinic I go to, they offer one brand of hearing aid.
Yes.
And it's like, how do I know that that brand is right for me? You guys work with all of the major brands, so I at least know that you have the option to go with them. And that is a decision maker for a lot of patients.
Yeah, and I think I've had a lot of patients call. I scheduled someone last week who went to a provider in a certain area in the valley and was only offered one manufacturer, and they felt uncomfortable with that. The problem is that not everyone knows that. Some people go in and they don't realize that only one manufacturer is a red flag, and they just go with it because they trusted that medical professional to make the right recommendation, and it wasn't the right recommendation. It was the only recommendation based on your insurance or based on what they worked with.
And if you ask a clinic like, well, why this hearing aid? If they tell you, oh, because this is the best hearing aid on the market, that is the true red flag.
Leave.
There is no such thing as the best hearing aid on the market, which is why we have to work with multiple brands if we want to make sure that we're making the best recommendation. If you want to hear your best. If you don't care, like, go wherever. It doesn't matter. Right? If you don't care about your hearing, we probably don't want to come to us because we'll end up caring way more than you will. And you'll be like, these guys are insufferable. I cannot stand Applied Hearing Solutions. I wish I would not have scheduled here. But nevertheless, hopefully this has kind of cleared things up a little bit with the types of appointments that we have at Applied Hearing Solutions for someone who might be new to hearing treatment or hearing loss, and someone who might already have hearing aids but you're struggling with hearing aids. You're either going to get scheduled for an Applied360 Discover appointment or an Applied360 review appointment for your consultation. And if we identify that it's your needs are anything other than those, we will not schedule you with those. We'll schedule you in the most appropriate. But Ashley, thank you so much. First time on the Dr. Cliff Show. Check that one off the box there, right? Jenna, thanks for joining us again. Great discussion, ladies. Guys, if you enjoyed this episode, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. And we'll see you in the next episode.